Good afternoon, and thank you for joining us this afternoon. My name is Tony Castrilli. I'm the Director of Public Affairs for Fairfax County. Before we hear from our speakers, 3 quick communication items. First, this news conference is being live streamed on the County and Health Department's Facebook pages, the County homepage, and live in the County on Channel 16. Also, for updated news and information, please visit the County website, fairfaxcounty.gov. Click the Coronavirus Updates link at the top, and also follow us on social media. Finally, I want to share a new communication tool with you in the community. A keyword text system has been established. You can now text FFXCOVID to 888-777 and receive news and updates from Fairfax County. Now you're going to hear from 3 speakers. First will be Chairman of the Fairfax County Board of Supervisors, Jeffrey McKay. Second will be Fairfax County Health Director Dr. Gloria Addo-Ayensu. Third will be Director of Epidemiology and Population Health, Dr. Benjamin Schwartz, also from the Fairfax County Health Department. In addition, joining us on stage is Dr. Stephen Jones, President and CEO of Inova. In the audience is Fairfax County Executive Brian Hill. Also in the audience is Fairfax County Public School Superintendent Scott Brabrand and several members of the Fairfax County Board of School Board. Following the remarks, we'll take questions here on the stage and answer your questions from audience members if necessary. Thank you. Chairman McKay.
Thank you very much, Tony, and good evening. Thank you all for joining us during these trying times. As you can see by the people assembled here today, we are in regular coordination with our health department, public schools, and health system. The Fairfax County Health Department has confirmed today that Fairfax County has 2 new presumptive cases of COVID-19. Additionally, a short while ago, Governor Ralph Northam declared a state of emergency in the Commonwealth of Virginia and announced the precautions the state would be taking to continue to prevent the possible spread of the virus. This is a very serious matter, and the health department officials that you will hear from momentarily will update us on the medical risk factors. The coronavirus is a challenging and evolving situation, but we are well prepared in Fairfax County and have been for years. We're also joining the state in taking added precautions. We will continue to carry out essential functions and services. However, Fairfax County leadership is working to phase in additional teleworking and other remote work options as appropriate. Moreover, although the county buildings will remain open at this time, we encourage our residents to carry out transactions with the county online whenever possible. Additionally, the county is strongly discouraging large public gatherings, especially those with vulnerable populations present. However, if these events must occur, coordinators should ask themselves, can this event or meeting take place digitally? And are there accommodations that can be made to reduce risk factors? We must accept that this is a changing situation hourly. The county is prepared. There are 2 important items that we ask you to do to help us, and it's critical that everyone help us during this challenging time. First, when seeking out information, look to trusted government sources. Our health department, the state health department, and CDC. There is a lot of misinformation out there. Please go to trusted sources to obtain information. Continue to follow basic health guidelines that we have said before. Wash your hands, cough and sneeze into your elbow, don't touch your face, and stay at home if you're exhibiting any symptoms commonly linked to coronavirus. Health officials also recommend having 6 feet of distance between yourself and others when possible and practical. These might seem like simple steps, but will empower the community with information to help us contain this virus. My office and the county will continue to update residents as we receive confirmed information. Next, you'll hear from Dr. Gloria Addo-Ayensu, who is the Director of the Fairfax County Health Department.
Thank you. Good afternoon. I'm Dr. Gloria Addo-Ayensu, Director of Health for Fairfax County. Overnight, the first 2 presumptive cases of the novel coronavirus disease, or COVID-19, in Fairfax County were identified by the state laboratory, DCLS. Results will be confirmed by the CDC. Although these 2 presumptive cases now bring the total number of cases in the Fairfax community to 4, there are no signs of the virus spreading in the community, and the risk to the general public remains low. All the individuals who have tested positive for COVID-19 in Fairfax have been associated with travel to affected areas or are close contacts of people who have been diagnosed with COVID-19. They contracted the illness through direct exposure rather than through sustained community spread. Fairfax County has been taking proactive actions to prepare for the possibility of cases occurring in our community, and are working with county and community partners and our residents to increase awareness and encourage prevention actions that we can all take to limit the spread of illness in our community. At this time, as you heard from the chairman, there are things that each of us can do individually and collectively as a community to reduce the risk of COVID-19 in Fairfax County. Every resident has the responsibility to practice good respiratory and hand hygiene and to stay home when sick. We are also working with partners to develop guidance on public gatherings. This will include which events should be canceled or deferred, factors to consider in decision-making about cancellation, and approaches to increase the safety of participants. The goal is to decrease the spread of disease and protect those at increased risk for severe illness while minimizing the social and economic impacts of COVID-19. Now I'm going to ask Dr. Benjamin Schwartz, who is medical epidemiologist and division director for epidemiology and population health at the Fairfax County Health Department. Thank you.
Good afternoon. I'm Dr. Ben Schwartz, and what I'd like to do is to share with you information about the 2 new presumptive positive cases of COVID-19. The first Fairfax County patient is the spouse of a presumptive positive case who had been diagnosed in North Carolina. The individual, a resident of Fairfax County in his 60s, became ill with respiratory symptoms on March 2nd. When the health department found out about the North Carolina case on March 9th, our investigation identified the ill spouse, and specimens were sent to the Virginia State Laboratory for testing on March 10th, and they were positive for the novel coronavirus. And this individual is isolated at home. The second case is also a close contact of the same presumptive positive case from North Carolina. This is a Fairfax County resident who is in his 20s. He became ill with symptoms on March 6th, and again, following identification of the North Carolina case, specimens were collected to be tested at the Virginia State Laboratory on March 10th, and these also have been reported as presumptive positive. And this individual also is isolated at home. The health department is working to identify additional people who came in close contact with these individuals and may be at risk of becoming infected with the novel coronavirus. Persons who are identified as close contacts will be self-quarantined and actively monitored for fever and signs of respiratory infection. If they experience these signs, they will immediately undergo testing. I want to share what we know so far about contacts from these cases. The first case stayed at home and away from others from the time he first became ill, and he had no contacts that we know of that require further investigation. The second case had contacts in his home, in his workplace, and at one community location. He also made one healthcare visit, but during that visit, he appropriately wore a face mask the entire time, minimizing the risk of exposure to others. In all these locations, we have the names of the people who were exposed, so we are not releasing these specific locations to the public. In none of these settings have children been identified as being exposed to this infection.
Thank you, Dr. Schwartz, and all of our speakers. We'll now take some questions from the media. Shamari?
Hi, Shamari Stone from NBC Washington News 4. Governor Larry Hogan announced that... I'm Shamari Stone from NBC Washington News 4. Governor Larry Hogan announced that all public schools in Maryland are closed March 16th through March 27th. Two questions. Number one, what is the plan for Fairfax County public schools? Number two, I see all these officials up here in suits. What do you say to parents who are concerned that somebody from Fairfax County Public Schools isn't speaking right now?
Superintendent Brabrand?
And what is the plan?
Good afternoon. Fairfax County Public Schools takes very seriously the COVID-19 challenges that are before the community today. Our plan is to continue to monitor and work closely with our local health officials here in Fairfax County to look at the data and to help us guide with a tiered response. We recognize the importance of safety for all of our students and staff, and we're going to continue to collaborate with the county officials and the county health department to make the appropriate responses. I'll be communicating with the county parents and families later this evening. A tiered approach. We will be open tomorrow, as will Arlington, as will Falls Church City, as will Alexandria, as will Prince William County. I was on a call with Northern Virginia superintendents at 12 o'clock today, and again, the information as we've consulted our local medical authorities is that we do not have community spread here in the Northern Virginia area. We're going to continue to work collaboratively with them to make decisions in the best interests of our students and staff, and we will follow the data to help us make the appropriate decisions.
What do you say to parents watching this who are saying, what are you waiting for? Why don't you just close the schools?
I would say to parents who are watching that I'm a parent in Fairfax County Public Schools, and I am the school superintendent. I take very seriously the issue of safety and security of our students and staff. We woke up this morning to having a neighboring school division make a decision to close their schools. Every school system has to work with their local medical authorities to help make those decisions. We are working with our local medical authorities. We spoke with Dr. Gloria and her team this morning, and we are continuing to work with them and following a tiered approach to make our decisions.
Are you prepared for parents who are concerned about, if you have students who aren't going to school, do they have tablets? Are they going to go online? Are you prepared for that? Do you have a structure in place to deal with that issue?
You may know, but maybe not. We did share with the community earlier this week that Fairfax County Public Schools had a proactive plan. On Monday, we will have a student holiday. Staff will be coming in to prepare in the event that we have a school closure or closures. Staff will be coming in to prepare for distance learning. We will have an extensive plan that we'll be sharing with the community if a school closure or closures is necessary. So we've been proactive from the beginning here to prepare. We know the anxiety that all of our community faces right now around COVID-19, but it's important to continue to stay calm and stay informed. And Fairfax County Public Schools promises to have our community, our families stay informed. We've sent out several letters and will continue regular updates, including at our website, www.fcps.edu.
We had a question here and then there.
I was hoping to get some more information about what you're sort of working on in terms of Now, you mentioned that some employees are going to start transitioning to telework. I was hoping to get more details on that and what the county will do in terms of contractors who were going to not be able to telework.
So the county has a telework policy in place already. The discretion is granted to the agency directors. I think what we want to be clear about is that essential functions of county government, regardless, will continue. Those agency heads have been encouraged to work with employees within their department to determine who is available for telework and who can take advantage of that opportunity. So it's going to be on a case-by-case basis. What we are communicating out to our agency directors is to be as robust as we can be without cutting out essential county operations, and so it will be evaluated on a day-by-day basis. But we have a telework policy in Fairfax County government in place year-round, and largely we are adhering to that, but encouraging flexibility within individual agencies.
Hi. Just hoping to get some further clarity on the two most recent cases and how that contact was made. Is the North Carolina case a Fairfax County resident, or the two most recent cases, did they travel to North Carolina? How did that happen?
The North Carolina case is a Fairfax County resident. The exposures occurred in Fairfax County, and then she traveled to North Carolina, where she became ill and was diagnosed.
Annalisa Gale with Channel 7, ABC 7 News. Quick question on the economic standpoint. Are we doing anything in the county in terms of providing assistance for people who may have to take days off work, anything of that sort? I have another question after that.
Before we answer that question, just a clarification on the earlier point.
Yes, I apologize for misspeaking. The exposure initially occurred in Boston, not in Fairfax County.
Yes. From the economic standpoint, what are we doing to assist those who may not be able to afford taking days off work and staying at home with kids?
Well, this, of course, is one of the balancing act challenges that we face, and it relates to the school question. So public health, of course, is our number one priority. The county is beginning to evaluate things that we can do as county government in those areas, both working with our nonprofits, working with state officials on state programs that were announced earlier today. Obviously, the Commonwealth announced a state of emergency, which changes some things. So we're going to begin working through those. But again, right now our focus is on the public health component. We realize that any decision we make has real economic challenges, particularly for people in our county who are most vulnerable. And so any decision we make is with that framework in mind. And so we don't have anything official to announce today, but we are evaluating a number of different things that we can do to help in that event.
And the second question is for the doctor. In terms of someone who has already been diagnosed with the coronavirus, can they get it again? And what precautions should they be taking, to prevent themselves from getting this again?
To the best of our knowledge, after one becomes infected with this novel coronavirus, they develop immunity to it. And we don't know if that immunity is lifelong, but similar to other viruses, we expect that it would be long-term protection.
Do we have any other questions, Shamar?
Yeah, I have one question, last one, for Dr. Gloria Addo-Ayensu. Shamari Stone from News 4. What do you say to people who say, this is not a big deal, the coronavirus is just like the flu? I just want you to basically explain the difference for people who have that view, because I've talked to people and they say it's not a big deal, it's just like the flu. It is not, and I would like you to explain that, please.
So the novel coronavirus, like all new viruses that enter the human population, the challenge with these viruses is that we don't know. We don't know its potential impact. With seasonal influenza, even though it infects about, close to 1 billion people throughout the world, and causes, what did the statistics say, but 500,000 or so deaths every year. It's something that we've become comfortable with. Many of us here probably have had the flu before. Our family members have gotten the flu before, and we've survived. And so we have a comfort level with the flu. With this new novel coronavirus, we don't know. What we currently do know is that in about 85% of people have mild illness, and that about 15% of people have severe illness, and of that, a percentage of that of those people die. And it's that unknown, and the fact that is what makes us have to be vigilant and take this seriously, to especially protect those vulnerable individuals who tend to have negative outcomes. These are the elderly, people with underlying medical conditions, and so on and so forth. So that's the difference, is that with novel viruses, no one is immune, and so everyone is susceptible, and therefore the impact could be quite grave, and we just don't know.
We have a few more questions. Tony?
I'm sorry, I got confused by the second response to the North Carolina case. So is it that the North Carolina case had the exposure in Boston? Okay, and what was that person's level of contact before her diagnosis?
I'm sorry, what do you mean by, in terms of her, in terms of that person's exposures?
Correct.
So, again, the individual was exposed in Boston, and obviously exposed the first case that we've talked about today. And as we've done the contact investigations, I'm not going to go into details, but as Dr. Schwartz mentioned, the people whom to actually start off with, North Carolina that did the investigation, the contact investigation, and then notifies the jurisdiction from whom there could be potential contacts. And so that's how we got notified. And so that brought us to the case number 1, and we began to observe that person, ask the person to be in self-quarantine, and began to look at contacts of that individual. We don't wait for results of tests to come back positive before we do the contact investigation, because when that happens, you have no time. Time is of the essence, and so we take advantage of the time that it takes to get the test done and to wait for the results, to do a thorough contact investigation and to identify potential sites where exposures have been, and to then take a look at who we might have to talk to should the results come back positive. And as of now, as Dr. Schwartz mentioned, there hasn't been exposures that have involved children or anything of that nature.
But did that person go from Boston to North Carolina, or was there a stopover period in Fairfax County where possible exposure occurred?
That person went from North Carolina to Boston and back to North Carolina, but has ties to the first case that we described today. So Fairfax has been home to this individual before.
This question is for Dr. Stephen Jones. Dr. Jones, in terms of just the influx that we may be prepared to see at the hospitals, what are you seeing currently? Are we prepared for testing, that sort of thing?
Yeah, I want to reassure you that we've been watching this for quite some time. our team started monitoring really in the early weeks of seeing this outbreak when it was not even anywhere close to the United States. During that period of time, we've assured that we've got our teams trained up, that we focused on what we do every day, which is infection prevention, taking care of patients with respiratory and other infectious diseases. So this didn't catch us off guard at all. Quite the contrary, we were prepared. And in fact, I was with that task force this morning, and they were going about their routine business of assuring that all these things are in place. So at this point, the healthcare system is well prepared for this. What we have to do is to hope that we won't see people coming into the healthcare system who shouldn't be. When we talk about social distancing, to have people coming into the emergency departments or other places out of fear is something we hope to avoid. And as you know from all the misinformation and some accurate information, there's a lot of fear out there. So we know that we've got the care for you, and our hope will be that people will seek that care when they're ill and stay away from the emergency department in the other times so that we can focus on the people who are ill. And we're especially making sure that we take care of our own team members, doing everything we can, which this is routine business in healthcare to prevent infection among the people who are taking care of infected people. We have extreme confidence in our team's ability to provide for the care of the community.
I think we have a question up here.
Yeah, I guess my question was sort of related to that, but do you have an update on how many people in Fairfax County have gotten tested? And also, would you say that you haven't, so far you haven't seen any sort of like that influx of people yet that you're sort of worried about?
Dr. Gloria, would you answer the first question, and then Dr. Jones the second?
So, as of last week, commercial labs are able to perform these tests as well. So it's made it difficult for us to get a handle on exactly how many tests have been performed, because we certainly won't get the results of negative tests. We only will become aware of positive tests. So I'm not able to give you an exact number of how many tests have been performed in Fairfax County. Given the availability, as the availability of testing increases, we expect to see more and more individuals get tested.
Can you repeat your second question for Dr. Jones?
I guess just because you were talking about how you don't want to see like a lot of people coming into the hospital out of like panic or anything. So just to confirm that Nova hasn't seen that.
We've certainly seen some people come in concerned, and that's not at all surprising. We did our first review of a person under investigation several weeks ago, which turned out to be one of the way more common things that happen this time of year, influenza, other viral infections. And so we've seen far more people who have been tested than are positive. I don't have the numbers on people who have been tested, but at this point, it's not an overwhelming number of people being tested.
One or two more questions.
Just last question. Again, well, right now, this is as we speak, teachers are actually going to my Twitter feed at Shamari Stone, and they have a couple more questions for the Fairfax County Public School official. Do you mind coming to the podium, sir? Again, I'm working for them. I'm just a messenger, sir. Thank you. A teacher says to me, thank you for asking about Fairfax County Public Schools not closing in light of Maryland and other locations. It is becoming uncomfortable to be a Fairfax County public school teacher. There is no hand sanitizer, no access to paper towels. Number one, what do you say to teachers who are concerned about, this and feel uncomfortable? Number two, do Fairfax County public schools, we're talking about elementary, middle, and high schools, have proper hand sanitizer and access to paper towels?
Yes, they do. They have complete access to hand sanitizer, paper towels, hand soap. There was a little issue yesterday with a few of our schools that tried to order soap and weren't able to successfully get the soap because our warehouse had already ordered the soap from the supplier. I spoke with the director of facilities management today to make sure that those schools did get the soap that they needed. We're continuing to work to clean our schools every day, to deep clean our schools every day. We have cleaning protocols with the cleaning that we use that does kill. We've confirmed with medical officials that the cleaning protocols we use does kill viruses, including COVID-19. We're going to continue to clean our building well. We want all of our teachers, we want all of our families to feel comfortable. And right now, I'm not sure anyone in our viewing audience feels comfortable about COVID-19. It is an issue of serious concern. What we need to think about is what is the appropriate reaction, and do we have a tiered response based on listening to our medical professionals? And Fairfax County Public Schools is working very closely, almost on a daily basis. In fact, the last several days has been a daily basis. We have health officials in our school district working with the health officials in the county to bring us the latest information. And they have informed us that if we were to have a positive response, we would make a decision to close that school or schools where that was to happen. We don't have that information. We do not have community spread in Fairfax County according to the health officials that they've shared, and we need to continue to work together, collaboratively together as a Fairfax team to make sure we're bringing all of the community the latest information. I'm committed to doing that as superintendent, and I know the county executive, Brian Hill, the chairman of the Board of Supervisors, Jeff McKay, the Board of Supervisors and School Board want to work together to give the community the latest information. We want to keep our students safe. We want to keep our teachers safe. We want to keep our families and communities safe. And we want to follow our medical experts to help us come up with the appropriate set of responses. We're open tomorrow. We have our planning day on Monday, and we will continue to monitor developments as they evolve and continue to keep our community informed.
Okay, thank you. Do you have one more question? Okay, last question then.
I know we are all waking up to some pretty shocking headlines in the last 48 hours. Is there anything you all would like to say to people who may be panicking at this time?
Chairman McKay?
Yeah, sure. So as I mentioned, these are obviously very trying times. And I think the strong message that we can convey to the public is that we live in a well-resourced county that is prepared for the type of challenges that we're facing right now. We have very well-trained professionals, well-established plans and protocols to deal with these type of situations. But anyone who's watching the headlines of what's happening nationally has reason to be very concerned. And my message for them is please don't panic. Please follow the guidelines of trusted government sources. We will respond every step of the way with every challenge that comes before us. We've faced many challenges as a community before. We will come out on top of this, but we need people to maintain composure, calm, be responsible, adhere to our guidelines, help us. And obviously the stress that our community has is significant. And anyone watching the news right now is feeling that stress, and we acknowledge that. Frankly, our workforce is feeling that stress, and so we have to remain strong and vigilant as a community, and I know we'll do that in Fairfax County.
Thank you very much. That concludes our news conference. We appreciate the time that you spent with us this afternoon, and thank you to our speakers. Thank you.